Good morning, everyone. I want to thank you for joining us here today to give an update of what's happening in Tacoma as it relates to COVID-19. I'm Victoria Woodards, and I happen to be the mayor of this great, resilient city. I am joined here today with Dr. Anthony Chen, who is the health director for the Tacoma-Pierce County Health Department, as well as Scott Hines, who is the president of the Tacoma Public School Board. We are here to provide you with updates, especially to our community members, on what we're doing to mitigate the impacts of COVID-19. As you are aware, the World Health Organization recently announced that COVID-19 outbreak is now considered a pandemic. And our health experts have confirmed that the increasing spread of COVID-19 across Washington state significantly increases the risk of exposure and infection to Washington state residents and creating an extreme public health concern. Here in Tacoma, we are scared and concerned for all of our residents. Our paramount duty as a city is for the safety and healthiness of our residents. And what I want to assure Tacoma residents today is that we will get through this, and we will get through this together. We are working together. We've put out a lot of information and several press releases, but we wanted to call this forum today to let you know that we are working together. We are standing together and trying to provide every opportunity we can to make sure that our citizens stay safe and healthy during this time. One of the things that I want to say right now is I really want to express my thanks to the Puyallup tribe. When we think about the health and safety of our residents, they had a choice. And they made an excellent choice in shutting down the casino for the next 2 weeks. So I really want to thank them for their leadership in helping to keep our community safe. Now we have a lot to cover today. So with that, I'm going to call up our Director of Health, Dr. Anthony Chen, who will give you an update. Dr. Chen.
Thank you, Mayor. Having been on our Board of Health before, I know you understand public health, and thank you so much for your support. I'm Anthony Chen. I'm Director of Health of the Tacoma-Pierce County Health Department. We have been busy working with our partners, including the City of Tacoma and Pierce County, to keep our communities healthy through this unprecedented health threat to our community. To give you an update, as of yesterday, we have 38 cases of confirmed COVID-19 in Pierce County. We continue our case numbers each day by 2 p.m. So those who are interested can check our website or subscribe for updates from our website to stay up to date. I do have some good news, and in situations like this, it's always good to have good news. Of our cases, a number of our people are doing well, or I should say the majority of the people who've suffering from COVID-19 are doing well and recovering at home. A few are still in the hospitals, and several have been discharged from the hospital. And that includes the first case, if you remember, we announced 12 days ago. In line with Governor Inslee's restrictions, we are taking public health measures to slow the spread of COVID-19 in our community and working with our partners throughout Pierce County and with Mayor Woodards and the City of Tacoma to implement social distancing measures. You notice quite unusually we are a little bit further apart than we normally are, and that is intentional. And I know those of you in the audience are as well. I regret to say that the health department has had to limit some services. We know that many of the services we provide are critical to the community. However, in keeping with the recommendations that we have told other people, we are trying to do the same. So many of our services are available online. However, we know that we will not reach everyone in the community, so we will continue to serve permitting and vital records customers who need in-person assistance, that we will work with them to see what we can do. A lot of those services can be done online or by phone. You may also know that we take care of some of the most vulnerable in our community through our methadone treatment services. They are still open from 5:30 in the morning till noon. Staff, of course, are observing social distancing, and they've made some adjustments to their procedures to maintain social distancing. We also do have a STD/HIV program that's working on an alternative service plan. We have identified internally who is able to work at home and who can conduct other business off-site. And of course, we have adjusted our meeting schedules and how we meet. I want to go back to our incident response. In addition to investigating an increasing number of cases and ensuring people take the necessary steps to limit the spread, we are working very closely with our hospitals, healthcare systems, and long-term care facilities on surge planning. We're collaborating with federal agencies and the city of Tacoma on a testing site. We continue to work closely with schools on the child care and nutrition planning. We are working with our city and county partners on operational plans for isolation and quarantine sites for people who cannot isolate or quarantine themselves at home. We know that one of the pain points for members of the community is to be able to get tested. Testing capacity is increasing as the state lab, University of Washington, continue to test, but also understand additional private labs are coming online as well. The situation's evolving, but what we do know and what we can prepare for is that we believe 80% or better of the people who contract COVID-19 will experience mild symptoms and recover at home. On the other hand, people who are age 60 or over and those who have underlying health conditions need to take extra precautions and definitely take social distancing seriously, because those are the people we know who are going to get sicker. I think it's also very important for us to remember that those of lower socioeconomic classes and more vulnerable also tend to become, or more likely to become ill, more likely to die from this illness. And so we have to make sure that support services are available for those members of our community. So we all have a role to play in preventing the spread of disease. Through social distancing guidelines, staying home when you're sick, avoiding public gatherings, teleworking as much as possible, practicing good hand washing, and covering coughs and sneezes, we can help protect ourselves, our families, and the most vulnerable in our community. Please continue to help us share accurate and reliable public information. You can access it at our website, which is www.tpchd.org/coronavirus. With that, I'm going to pass it on to Scott Hines.
That's all right. That's all right. Thank you, Dr. Chen. And I wanted to also let you know we will be taking questions at the end of this. We also are joined in the room by several of our leaders here at the city. We are joined by our Chief of Police, Don Ramsdale, our Fire Chief, Tori Green, as well as our City Manager, Elizabeth Pauley. Head of our Community Services Department, we have thank you, Linda Stewart. We're also joined by Jackie Flowers, who runs Tacoma Public Utilities. So, and we also have Jeff Robinson, who's the director of our Economic Development Department. So we will take questions at the end and have all the experts in the room. I do want to take this time also to say thank you to our governor who has really been out front and been a leader in taking some real strong steps to trying to contain this virus. And so I want to thank him for his leadership. One of the first things that we worked on together was the closure of schools. And I know this has been very difficult for citizens and for residents in Tacoma, but believing it's the right thing to do. If we can get ahead of other countries who have suffered much worse than we are doing right now in Washington State, really the goal is to flatten this and to give us an opportunity for both our medical facilities and for all of the services that we provide to catch up so that we do not find ourselves like Italy and other places. So I'm really grateful to the governor who has stepped up and made some really difficult decisions, but who is really making the best decisions for all Washingtonians. As I said earlier, one of the decisions he made was to close schools. We are working very closely with our school partners. I do want to thank Carla Santurno and Scott Hines, who will be here in just a second, for their leadership and for all the partners who have jumped in in. We launched just a couple of weeks ago Compassionate Tacoma during my State of the City address, of which we went to an alternative format. But we launched it because we know that here in Tacoma, when one person is hurting, we all care. And so how amazing that we would launch Compassionate Tacoma, and now it's a time for us to show our compassion. And one of the groups that are showing their compassion is our school district. And to all of the parents and children who are home right now, thank you so much for following the rules that we've been giving to really protect all of our residents. We know it's difficult, but I want to thank everybody who surrounded schools and helping to make this as easy as possible. So with that, I'd like to ask Scott Hines to come forward and give an update from the school district. Scott.
Thank you, Madam Mayor. My name is Scott Hines, H-E-I-N-Z-E, and I have the pleasure of serving as the president of the Tacoma Public School Board. We were able to get a little bit of a head start in Tacoma. On March 7th, we had someone at Mary Lyon Elementary School diagnosed with COVID-19. So we've been in a close partnership with the health department for a couple of weeks now, and it gave us a head start on some of the planning. This has been a very fluid, rapidly evolving event. The CDC passes guidance down through the U.S. Department of Education, and then that guidance comes to local school districts, and that guidance consistently has said work with your local health department. We are subject matter experts when it comes to educating students, and the health department is the subject matter expert when it comes to putting in the best public health measures to keep kids and staff safe at school. So I want to thank Dr. Chen and his team. We have been I was going to say arm in arm, but we've been socially distanced. We have been in a strong partnership, and we could not have undertaken this work without him. I also want to thank the mayor and the city manager last week for proclaiming a state of emergency. There's a new normal in Tacoma, and that state of emergency helps us as a government to do things, but it also should serve the people of the city of Tacoma that things are changing, and they're going to change for an extended period of time. And I want to reassure you that as your elected officials, we are in communication with one another on a daily basis. The board took action last Thursday after the governor directed schools to close. In fact, Wednesday, coming back from the press conference, I was on the phone with the mayor and with the county executive, and in that moment is when we began to plan as community elected officials. And I asked the mayor and the county executive to convene all 15 public school districts in the Pierce County area so that we could begin working collectively on plans to feed and care for students. Our Superintendent Santorno, our Deputy Superintendent Josh Garcia, last Monday activated the school district's Emergency Operations Center, and we had been leaning forward in a planning posture since last Monday. The good news, we yesterday began providing meals for all 30,000 students if they would like it at our 10 middle schools in Tacoma from 10 a.m. until noon. They get 2 meals. Our Chief Operating Officer, Chris Williams, had to do some work with the state and the Fed around relaxing regulations that say you can only serve 1 meal at a time. We have a drive-through set up when those students come to campus. They get that day's lunch and next morning's breakfast. We know in a district of 30,000 students that's high poverty, there are a lot of kids that eat most of their meals at school, and it becomes a hardship when school is not in session. And so we're doing everything we can to try to help mitigate that food insecurity that kids and families may be facing. We also met last Friday. I had asked Tacoma City Council member Catherine Ushka, who also chairs the Tacoma Pierce County Health Board, to convene elected officials. And we were, the meeting last Friday was the meeting of the 15 school districts, and we met Friday afternoon at the Pierce County Emergency Operations Center so that we weren't planning in silos. All 15 school districts now are connected through the emergency management system. We talked about our feeding plans, we talked about our child care plans and other things that schools may be able to do. In Tacoma, we have 70 campuses that we may be able to leverage for a variety of purposes going forward. We have a transportation fleet and drivers that may be able to be a community resource as we work through this emergency together. One of the cool products that came out of that meeting of the 15 school districts, we had GIS mapped the 10 sites in Tacoma where people can go to receive meals. We put together, Executive Dan Meyer had the Pierce County IT department put together a map of all the feeding sites in Pierce County, and that's live right now. And the reason behind that is we know, for instance, our McKinney-Vento students may go to school in Tacoma, but they may live in Lakewood. We're not going to make a kid figure out how to get to Tacoma if he's hungry. Clover Park will feed that student, and we will do the same. And there is this agreement amongst all 15 school districts that we're going to take care of kids and families, and we're using the GIS map as just one example of how we're cooperating together. The child care issue is a little more challenging. I want to thank Chris Reichdahl, the superintendent of public instruction. He and his team have been providing very good guidance. They've been thoughtful and decisive in their decision making. He said to school districts, treat this like spring break. Like this is a week of planning, and we're using that week of planning to address child care. The governor's directive said, please provide free child care for families of first responders and healthcare workers, and we're working to do that as safely as we can, but that is yet to come online. Now, while the superintendent of public instruction said to treat this like spring break, for our students, we don't want this to be to feel like an extended spring break. The evidence shows that kids do better when there's structure in their life. And so we encourage families to begin putting a schedule together for their students so that there's some routine to the day, there's some certainty to the day, especially when they're bombarded with, in the 24/7 news cycle, all of this talk about COVID-19, that they need that stability and assurance that a schedule can provide. Public education, that we've received questions, why don't you just move to an online learning platform? For a school district like Tacoma with 30,000 students, it becomes an equity issue where we have students that don't have access to the internet or to a device. There's also ramifications for our students that have individual education plans, IEPs, and our ability to deliver what's in the IEP, the accommodations that some students need through their 504 plans. We want to create a learning platform that is usable for all students and families. And so the superintendent directed her team to put together lesson packets, K through 12. We've translated them into multiple languages. They're PDF'd and they're online and available to families as a supplemental resource to try to build that structure of learning for at least the next 6 weeks. And we already have our community partners. Part of the transformation of the Tacoma School District is because of partners, and partners reaching out to us to provide opportunities for families for supplemental learning materials and resources and distribution. I heard the Tacoma Weekly was talking about potentially putting an insert into their newspaper for those families that don't have access to the internet, that may not be able to print out those lesson plans, that we're working on ways to get those hard copies available to families as well. And lastly, I just want to assure the city of Tacoma that your elected officials are working in collaboration. That I had reached out to Catherine Ushka, who is a city council member and who chairs the Tacoma Pierce County Health Board, and asked her to put together a call of local elected officials. The mayor was very supportive of it. We're unified in our desire to be coordinating. We had a call yesterday with emergency management and the health department to get all of the elected officials in Tacoma on the same page so that we can figure out how we're going to work through this together. I tell people it's not a marathon, it's an ultra marathon. We need to pace ourselves. We need to make certain that we're all working together for the common goal of keeping people safe and healthy in Tacoma. And I just in closing, thank you, Mayor, for your leadership. I appreciate the opportunity to be here today, and I look forward to answering any questions.
Thank you, Scott, and thank you to the school district for everything that you're doing for our families, and especially our kids. So I want to take a moment now and give you some updates from the city of Tacoma. We've had a lot of questions about a lot of our services, and so I want to take this time to kind of update you. So first I'm going to start with neighborhoods and community services and give you an update of what we're doing in neighborhood and community services. We've been getting a lot of emails and requests around what we can do about renters in Tacoma. Over 50% of the population in Tacoma are renters, so I want to assure you that we're looking both into what we can do around evictions. We're also talking with the state and others, the federal government as well, about what we can do about foreclosures as well during this difficult time with all of our businesses. Or the majority of our businesses, especially our small businesses, being shut down. We want to make sure that the one thing that you're not worrying about is how you're going to pay your rent or if you're going to get foreclosed on. So know that we are working on that and hope to have an announcement very soon about how we're going to address that. For the service providers who are working every day in our community, for our nonprofits who serve the most vulnerable residents in our community, and who receive funding from the city of Tacoma. As it stands right now, let's be very clear, we are going to continue to fund those organizations. The other thing that we are looking into and are moving forward is not only are we going to continue to funding you, but we're also want you to understand that right now, and we need to be, if you haven't been reached out to, please reach out to us. We're reaching out to all of our nonprofits. We are also wanting to relax the guidance around collecting data right now, because what's more important is not collecting data. What's more important is serving the clients who need the services the most. So we are taking that on as well. The other thing that we're doing for nonprofits, because we know, as Scott Hines just said, this is an ultra marathon, that the impacts of what's happening we'll begin to feel those for quite some time. So we also, in the 21-22 year, will not be asking nonprofits to submit during our competitive cycle. If you currently receive funding from the city of Tacoma, you will continue to receive funding, and we will make funding available for new organizations as well. So those are a couple of other things we're working on for our nonprofits. Again, if we have not talked to you, we have not reached you, please reach out to our Human Services Department so that we can make sure that we're addressing all the needs that you have as a nonprofit. The last thing we want you to do is be stressed any further. We want you to spend your energy and time focusing on your services and delivering them to those who need it the most. The other issue that I'd like to talk about is what we're doing in economic development for our small businesses. As you have heard, the governor has asked all small businesses to close, all restaurants to go to a different type of service, and that being, if you can support a local restaurant with takeout and you can order and swing by and pick it up, I encourage you to do that. But for other businesses who don't have that opportunity, there are some things that we're doing to address the issue for our small businesses. A couple of those things are, we are going to make sure that our businesses remain strong and viable and resilient during this time. Our first step to ensure that Tacoma businesses are connected to key information and resources that they need, we're asking you to go to the city's economic development website, and that's makeittacoma.org. Again, makeittacoma.org. On that website, we have information on topics such as business resiliency, financial support, employer and employee resources, and health and public services. We will continue to post new information as it becomes available, and the city is also working with technical assistance with SpaceWorks, the Small Business Development Center, Craft 3, and others to ensure that businesses can more easily tap into the services that we have available. We have also requested and received authority from the U.S. Economic Development Administration and the Tacoma Community Development Redevelopment Authority to plan for and set aside a portion of our loan resources for microloans to qualified small businesses in Tacoma. These microloans, up to $15,000, which can be used for working capital and some fixed assets to help cover some of the lost revenue. We will have a deferred principal and interest payments for a period of at least 6 months. So if you are a small business and want to take advantage of this or need technical assistance, again, makeittacoma.org is where you can reach out. There will also be they'll be expedited through administrative approval, so funds can get out to the businesses who need it the most more quickly. Currently, current borrowers from the city's Economic Development Administration revolving loan fund will be allowed to defer principal and interest payments on their loans without penalty for 6 months. And city staff will also be providing technical assistance to businesses that want to seek funding through the U.S. Small Business Administration so that it can be accessed more readily and more easily. With the city declaring a state of emergency in response to COVID-19, the city will also work to remove penalties related to B&O job tax in Tacoma. Businesses that are currently taking advantage of the city's B&O job tax credit will not be required to pay back the tax credit received prior to the tax periods if they reduce their workforce and lose eligibility. Again, you can get more details about that at makeItTacoma.org. The other thing I'll add is that the city we're also working to defer taxes for businesses paying $10,000 or less in B&O tax. And we will, as soon as we have all the details of that worked out, we will get that up on our website. Now, for those of you who are also Tacoma Public Utility customers, I am proud to say that just earlier today, the Tacoma Public Utility Board approved $1 million in emergency assistance program funds to help residential customers who are struggling to pay their utility bills. And tonight, as part of the city's declaration of a state of emergency, I will authorize the Tacoma Public Utilities to suspend disconnection for non-payment to all residents and business customers. Safety and reliability continue to be Tacoma Public Utilities' top priorities. And in these extenuating circumstances, they continue to work hard every day to maintain the highest quality of services for their customers. So with that, there are a lot of things that we are working on, but what we want to make sure is that we're giving you peace of mind to know that you can care for yourselves and your families, and that we're working out all of the details. As you can see from the presenters who stood with me today, we are all working together. I want to remind you that in Tacoma, while starting tomorrow, we will be shutting down City Hall for the public. And we've sent all personnel home who don't deliver essential services. We want you to know that we will be picking up your trash. When you dial 911, we will be answering your call and responding to those calls. So the essential traffic lights will continue to work. You can still call 311 if you have questions. If you can't get to our website or to the Pierce County Health Department's website, which is tpchd.org, Tacoma Pierce County Health Department.org. And right there, you can go on a link that will give you all kinds of information about COVID. But if you don't have access to the internet, please call 311, or if you have any other questions that you need answered, we also can ask you to call the Emergency Operations Center here in Tacoma, Pierce County. That number is 253-798-7470. There are lots of ways and lots of places to get good information. And if you're not finding the information that you need, please, 311, or as I said, the EOC, or the Emergency Operations Center at 253-798-7470. We are here to make this difficult time as easy as possible. As you dial these numbers, recognize that a lot of people need help, so I'm asking you to observe Compassionate Tacoma, be patient, and we will get either answering your calls or get back to you. Our staff is working very hard to respond to the needs of this community. I also want to remind you again, we launched Compassionate Tacoma. So if you're going to the grocery store, check with your neighbor and see if they need something. Check with a senior person in our community to see if they need something. If you have a need and you're a nonprofit, United Way is collecting all of the needs of this community and trying to match those. There are a lot of community groups who are interested in volunteering. So if you have a need or want to volunteer, you're welcome to call both the numbers I already gave you, or you're also welcome to reach out to United Way at 211. We are Tacoma. We are strong, we are resilient, and we will get through this crisis together, and we will come out on the other end of this stronger than we've ever been, and we will be the Tacoma that we all know Tacoma to be, the city of destiny. With that, I'm going to ask Dr. Chen and Scott Hines to join me, as well as our city manager. We will take questions. Again, there are lots of experts in the room, so we may call on another person at this time. So any questions at this time?
Mayor, I have a question about enforcement.
Yes.
When it comes to businesses that are required to shut down,
Yes.
those they choose not to, they continue to operate. Where does enforcement fall? Is that going to be from the police department, code enforcement, and will the city only act on reports, or is there checking, active monitoring?
So let's just be really honest, and I think the governor said it best the other day. He called on Washingtonians. I'm going to call on Tacomans to do the right thing for our community. Our services are already stretched, and sure, if someone calls and complains, we'll respond to the complaint, but we are not going to be actively checking to see if businesses are closing. We're asking businesses to do the right thing, adhere to the rules that have been given to us, and if you're part of the list of people who need to shut down, please do so. Yes.
Of the three largest counties in the state, Snohomish, King, and Pierce, we have the lowest numbers among those three.
That's correct.
Is that because of a lag in testing, or is it because you are finding fewer cases and we are keeping pace with their testing pace?
I don't think it's a lag in testing. I think what it is a lag in the natural progression of the disease. And also remember, King County had that real hot spot in the nursing care facility, which if you took that out, the numbers are much lower than they look. So it's a matter of time. I mean, it really is getting closer to the peak, if not at the peak in King County. Snohomish is probably not far behind that. We're probably lagging them, who knows, a few weeks, whatever. But there are challenges with testing, but that's not what's causing the numbers. It's just how disease spreads.
Can you touch again on the possible testing site or quarantine sites you were discussing earlier?
Right, those are two different things. So as the previous person asked about testing, that is something that's of current concern to the public. We know that our healthcare systems, Multicare and Franciscans, as well as Kaiser and other providers, have already made plans on designating particular offices or urgent cares where people can go get tested. There's conversation about doing drive-by testing, which University of Washington and some other places have done. So that's being implemented on a local level. The other thing that is coming, and we don't quite have a firm date on it, is the Health and Human Services has offered to do drop-in, drive-by testing sites. And we are in the process of working through that. The city of Tacoma has agreed to host that event. That will be a federal asset that will be available to residents of Pierce County. You also asked about isolation and quarantine. So what we have learned, and you've heard me say this before, sometimes it's good when we lag King County, right? We've learned from what's gone on up there. We know that there will be some people that we will ask to either isolate themselves or quarantine themselves, but they, for some reason, not be able to do that at home. So let me be clear. Isolation means you have the illness, and you need to stay at home so you don't get other people sick. Quarantine means you have come in contact with someone who has the illness. We don't know if you're going to get sick or not, but the infection may be brewing in your body, so we want you to stay home just so you're not shedding virus and getting people sick. So we know sometimes people may have family members who are in the high-risk categories, and so they don't feel comfortable going home to go into isolation or quarantine. So we want to make sure that we have facilities to support people in those situations. We're currently working with partners to identify this, about where we may be able to locate some of these. We're going through a screening process about possible sites. We're going through community engagement. Just want to say, huge amount of partnership on this. Some of the sites we've looked at, the owners have actually contacted either us or the county executive and offered their facilities. And as the mayor said, the community is stepping up to this. And of course, we're going to work with the community where we site this. We want to make sure there's good access for the whole community. We, of course, want to make sure these facilities are available so that people who need to be isolated or quarantined are able to do so.
Additional questions? All right, well, I do want to mention just a couple of things. When I said things are changing quickly, they are. I also want to announce that we are suspending parking tickets in Tacoma. So if you are parking down, we are not writing parking tickets for time violations. We are still doing health checks. So if you park in a handicap stall or other things, but you park in front of a fire hydrant, those things we will still ticket for, so be careful of that. But we are not giving out parking tickets as it relates to time violations at this time. I also want to thank all of my council members for all of the work that they've been doing. Again, we're not doing this work in isolation. We are working closely together. All of them would have been invited to be here today, but we are trying to observe the rules and thought it was more important to make sure that we had all of you in the room today so that you could help carry this message out to our residents. But I want to thank them for their leadership and all the work that they're doing out in our communities representing our districts. I think that is it, unless I've missed anything. I'm looking across the room, and if there are no more questions, again, there are lots of ways to get information. And I just want to remind that, Dr. Chen, come on, Dr. Chen.
I'm sorry, I have to clarify something. I was corrected. In terms of the federal drive-by testing site, that is going to be prioritized for healthcare and first responders to make sure they can get tested, because they're often the ones most likely to be exposed.
Just wanted to make sure there was no other late-breaking news before we close. So again, I just want to remind everybody there are lots of places to get information. Again, Tacoma Pierce County Health Department, tpchd.org has a lot of information. MakeItTacoma.com has information for businesses. You can also go to the City of Tacoma's website, cityoftacoma.org, United Way's website. Again, there are lots of places to get information. 211, if you have a need that you think that the community can address. Also 311, if you don't have access to a website or to the internet, we can provide you with that information. And again, also calling the Emergency Operations Center at 253-798-7470. I want to thank you all so much for joining us today, and I want to say to Tacoma again, we are the City of Destiny. We will continue to be the City of Destiny, and we will get through this together. Thank you so much.